So indeed, in our midst right now in Guyana, we have, I can tell you about the four most prevalent cancers, which are breast cancer, cervical cancer, prostate cancer, and as well as colon and rectal cancers. And these are very much have been affecting Guyanese citizens over time. And a lot of it has come from a lack of education and as well as lack of screening also for persons and not understanding how they can be able to make their health a priority. As such, the Ministry of Health, we have quite a few initiatives that we are ongoing for persons as it pertains to persons battling with cancer. We have our HPV voucher that was launched last year, which was to do the HPV testing, a very common STI that is usually the main cause of cervical cancer, and it can also cause other cancers like throat cancers, anal cancers, vulvar cancers. So that test would have rolled out last year, and it would have we would have closed it off in December. But thankfully, we are going to be rolling that HPV testing out again this year, starting from next month. In addition to that, we do have the ongoing campaign over HPV vaccination, which is available for all persons between ages of 9 to 45. So we do encourage persons, if you haven't gotten your HPV testing done, or ladies, and if you haven't gotten your HPV vaccination done, and that's for both men and women between that age group of 9 to 45, to do so. We also have the ongoing installation of mammography machines, primarily in regions 2, 6, 9, and 10, in a way for us to be able to, most of our healthcare, we can say, is more centralized. So in an effort to decentralize and also allow for early screening and for persons who might not have readily access available to Region 4 to be able to have that accessibility within their regions, that is our hopes of being able to have encourage early diagnosis and encourage routine screening. For our cancer patients, we do also have our mental health unit, which is readily available for persons who are battling this disease. We have seen many times over the years, because we don't prioritize our health, most times when we do go to the healthcare facility, it's usually when it's too late, or it's at a critical phase in our life where we have to go through so much more. So with early screening and early detection, it actually it decreases mortality rates and it increases your survival rate. So imagine having something available and not taking advantage of it. We do encourage persons to stay informed, follow our Ministry of Health social media platforms where you can stay informed about the different tests that we have available, about how you can take priority of your health. I always like to say prevention is always better than a cure. So where we can be able to minimize the effects or try to cancel it out of not having a disease, then we should absolutely take advantage of that.